that today we consider that there are two different FFA. Well, they are not very different FFA, but two ways to diagnose FFA, the classical FFA and the probable FFA. A classical FFA requires a frontal hairline recession, and that gives us 2 points. We need to get 4 points to get a correct diagnosis. So frontal hairline recession is required and it gives us 2 points. Then we can do a biopsy, and if it is positive, it will give us 2 more points. So then we will have 4 points. So we will get the diagnosis with these two with these two items. But it's true that we can use trichoscopy if we don't want to get a biopsy. We can check with trichoscopy if we see a perifollicular scaling or perifollicular erythema. That will give us 1 point each. So we will get the diagnosis also, or check if we have a loss of eyebrows. At least 50% of loss loss of the eyebrows will give us another point. Okay, so this is the scenario for classical FFA. And for probable FFA, I don't like probable FFA. From my point of view, the correct name would be atypical FFA because it is not so classical, but it is pretty common to find it because it is you can find this probable FFA in early stages of the disease. So the frontal hairline recession is not required. If there is some frontal hairline recession, you will get just 1 point. But it's true that we can get the diagnosis with trichoscopy again. The loss of vellus hairs is very important because it is a very relevant trichoscopic sign in early stages of the disease. The presence of facial papules, it is pretty common. It's not always in our patients, but it is a very important clue. And also the bilateral preauricular hair loss, this loss of sideburns is very important in some cases. So we can get a perfect hair, but if you have some loss of the sideburns, a loss of eyebrows, some facial papules, and some suggestive trichoscopic signs, you will get the diagnosis also, and without any biopsy. So biopsy is a good idea, but it is not for every case. And in my practice, I don't biopsy probably 98% of my patients. So we have to understand also that some clinical or trichoscopic signs are related to the progression of hair loss, like the hair loss and also the vellus hairs and the loss of vellus hairs. But the inflammation is, we can check inflammation with the perifollicular scaling and perifollicular erythema. Today is the only tool that we have to check inflammation. This is very important because some treatments are going to focus on inflammatory signs. So if inflammatory signs are there and they are persistent, we have to think about changing the treatment or increase the treatment. It is not enough. Well, this is the guidelines. It is not very live lecture. I don't recommend you to read this. Just to give you some ideas, the guidelines recommend us to check the hair density and inflammation in this every area. This is so complicated. We are very lucky in Frontal Fibrosing Alopecia because we can check inflammation just on the hairline in most of the cases.